Okay, well, we're about 4 minutes past, so I want to take advantage of all the time that you have and make sure we get the most done in this hour. So I'm going to kick things off. And first I should introduce myself. I'm Cliff Schmidt. I'm the founder and executive director for Amplio. And I want to start by, I'm going to share some slides with you and let you know what we're doing here at Amplio these days. Okay, so hopefully everyone can see my screen. I thought it'd be good to start with the mission of Amplio. It's always good to go back to that and hopefully refresh everyone on things that you might, sorry about this. This is the problem with adjusting Zoom and slides at the same time. Okay, so our mission, Amplio's mission, is to empower the world's most vulnerable communities through knowledge sharing. And for most of our history, we've done that through the Amplio Talking Book. And you can read some of the bullet points there about it, but a key thing that I want to remind everyone is that from the very beginning, this is about two-way sharing of education and ideas with low literate, hard to reach rural communities. Now I say two-way because of the microphone that's built in. So this is about providing access, equitable access, especially with understanding that not everyone has the same education and technology, especially women, to be able to access things that other communities and other members of communities can access. But that microphone allows people to listen and also share their own ideas and feedback to the organizations that are serving them. And of course covers a range of topics. So these topics cover most of the global goals, or also known as the Sustainable Development Goals. Certainly every one of those first 6 that you see there, and of course number 10, reduced inequalities, is particularly near and dear to our heart. And you'll hear me talk a lot about partnerships. So partnerships, this isn't even all of them, and most of these partnerships are active partnerships we have today. So we're doing quite a lot, and partnerships are really vital to the work that we do. I'll just mention some of the top ones there. Ghana's health service, the government of Ghana and UNICEF have teamed up to work with Amplio on a program called Integrated Risk and Emergency Response. So that program kicked off this year and is reaching more than 150,000 people with health information. We've partnered with CARE for about a decade now, similar to UNICEF, and in 4 countries. But I'll just highlight one of them in Bangladesh. There's a program called the Joint Action for Nutrition Outcomes, and they have also reached over 150,000 people with messages from Talking Books. So those 2 programs alone have made quite an impact this year. For the first time this year, we're working with the UN Food and Agriculture Organization, FAO. We're working with them in Uganda. We've got several of our staff involved in that project, specifically providing education and social and behavior change messages to enable women to be able to take advantage of their rights to own land. And we're providing quite a lot of other education there as well. And then at the end of that row, you'll see Tostan, a great organization that's been working in West Africa for over 30 years. And they are, with some funding from the Bezos Family Foundation, are reinforcing parental practices through messages on the Talking Book. We're also newly working with Catholic Relief Services this year in Ghana, ILC Africa and Malawi on another education project. And so don't have time to go over all of them. You also see CBCC, Center for Behavior Change Communication in Nairobi. And we're very happy to have Catherine from CBCC on the panel today. If you go to our website and click on the impact link, you'll be able to learn a lot about what we're doing, not just these big numbers you see here with our about 1.8 million people that we've now reached in 14 countries, but you'll be able to hover over each of those dots and learn about these different projects. So please take advantage of that so you can really understand what we are doing. Thought you might be also interested in how we've grown over the years. So we've been around since for 15 years now, since 2007. I'm only plotting this out since 2010 when we first started really rolling out these types of programs. And you can see the last few years we've been quite busy, especially this last year in 2022. And now if you add up all of those numbers all together, that's where you'd get the 1.8 million people that we've reached from our start. We've done a few other things in 2022. The top row, I've pointed out 4 different areas that our R&D has been focused on. So we have a new version of our talking book that is now rechargeable. But we also have put a lot of work into some software projects. So we have dashboards that allow us to monitor exactly how many times people are listening to what messages, what are most effective, where they're being listened to the most and where they're not, so that we can work with our partners on finding out what might be impeding that. And then some of this, not only do we get that data, but we get thousands of messages from people in these communities in every one of our programs. And so we've had hundreds of thousands of messages just in the last year or so that come through a new piece of software we developed, our user feedback software. And that allows people who speak the local languages. And remember, we've got dozens of these languages that people are listening to and giving us feedback in. They can listen to these messages and essentially tag them in many different respects. As someone giving feedback and they're very happy and endorsing either the talking book or the content or the local partner that is providing this service. And then also, what are their ideas? Is there anything we should flag? Any child protection issues we should get attention to right away? So that's in that software. And then we've also just kicked off a new initiative on social behavior change software. And so this is software to help guide our own staff, our partners, and it's something that we're going to make available to the whole world to be able to plan out their social and behavior change programs, to understand what are the social norms in each community. Why are people planting their crops a certain way, or assigning women only certain limited roles in their community, or not sleeping under bed nets to prevent malaria. So this software, it basically improves the content of messages that will be on talking books, but also can improve the program, any particular program at all, where you depend on members of a community understanding why they might want to make different choices and discussing that among themselves. Also in 2022, we received the Platinum Transparency Seal from GuideStar and an award from the Anthem Awards. We were invited back to the Clinton Global Initiative, part of the Clinton Foundation, and in just a couple of weeks, we'll be attending the International Social Behavior Change Communication Summit. So next year, and then I'll wrap up here and get to the main event. Next year, we will have reached our 2 millionth person through Amplio Talking Books. But it's not just about talking books. We are really investing quite a lot in our staff and in our software, in training programs, and in partnerships related to social and behavior change. So the answer isn't just to have a piece of technology, and the answer isn't even to have a piece of technology with local language content telling people what they should do. No, instead, what we've known from the beginning, but what we are investing more in our capacity to be able to provide other organizations more help in this area is an understanding of social and behavior change. Some of those things that I mentioned that basically comes down to how do these communities make decisions now, what's important to them, what are the social norms, what are the barriers in the way, what could make that easier? And given all of that understanding, how can your programs, the program design and the communication allow you to work with that community to achieve their goals? The final thing that I'll mention as a focus for us in 2023, and just to wrap this up, is Ghana-centered global impact. Now, those of you who have been with us for a while know that we started this program 15 years ago in Ghana, and most of our impact, and in fact, all of our impact was centered in Ghana for most of our first 9 or 10 years, I guess. Since then, we have achieved amazing things thanks to our team in Ghana, all on programs within Ghana, including that Anthem Award that I mentioned, which was possible because of the hard work and brilliant work of our Ghana staff. In parallel with that, we've had mostly US staff serving partnerships in 13 other countries. One of the things that we've been doing over the last year is integrating our teams together so that we're really taking the strengths of all of our staff, whether they're in the US, Ghana, or anywhere else, and being able to apply that to serve all of these different partnerships. It's the only way that we're able to provide the best quality of service to our partners, to be able to achieve the greatest impact everywhere, and to do that with fully utilizing all the staff we have. So what I mean by Ghana-centered global impact is that we are investing more and more in our Ghana team to be able to create new partnerships, to be able to support partnerships even beyond Ghana, including the ones all around the world. So that's the kind of the brief update on what we're doing, what we have in mind for the future. And now I'd like to just thank you again for being here, and hand this over to Dena Morris. Dena Morris is not only a member of our board of directors, she was also the president of the Washington Global Health Alliance and the director of the CDC's Washington office. So thank you very much, Dena, for leading this panel, and I'll hand this off to you now.
Thank you, Cliff. I really appreciate what you said on your last slide about this isn't just about the technology, but it's about behavior change. And I think that really sets up nicely the conversation that we want to have now. We really want to talk about the role of technology in global development and global health. And I think it's worth spending a minute on, just because as many of us have this tendency to glamorize technology, particularly here in the Seattle area, and that if we have technology, that must be the answer to something. But also, I think those of us who've been involved in global development and global health recognize that to rely too heavily on technology when you're working in a low resource environment is not always a good idea. So I'm delighted to introduce, or ask to introduce themselves, 3 of the world's smartest people when it comes to this intersection of technology, global development, global health, how we use technology, what's appropriate technology, and how do we get at what you talked about, Cliff, in terms of really using knowledge to improve lives through behavior change. And so what I'm going to do is ask each of you in turn to just spend a minute or two introducing yourselves and talking a little bit about your background and experience. And I'm going to start that with Livia Benavides.
Okay, well, Dena, thank you. And thank you for to the whole Amplio team for inviting me to participate in this panel. I'm very happy about that. I'm Livia Benavides, and I retired from the World Bank about 4 months ago. I worked at the World Bank for about 27 years, doing, of course, development work. That's what the World Bank does. And my focus was mainly on health, nutrition, social protection, and tech science and technology development. So those are my areas of work. Thank you.
Yeah, thank you. I look forward to hearing more from you. And Catherine Lengewe, can I ask you to spend a minute or two just introducing yourself and your role and your experience in this world?
Okay, thank you very much, Dena, and thank you for the opportunity to be together in this panel. My name is Catherine Lengewe, working with an organization called the Center for Behavior Change and Communication, based in Nairobi, Kenya. We specialized in doing social and behavior change communication programming across different sectors, and we happen to be partners for several years now with Amplio. We've implemented programs with the talking book, and we'll be happy to share our experience during the discussions today. So thank you very much, and looking forward to engaging in the next few minutes.
Yeah, thank you, Catherine, and welcome. And the last but not least of our three of the smartest people in the world on this issue is Akhtar Badshah. And Akhtar, can you maybe share a little bit about your experience with us?
Dena, thank you very much. And again, congratulations to Cliff and the Amplio team for the amazing work that they've done and the impact that they've had, and the large number of people that they've reached through the work that you're doing around the world. So congratulations to all of you, and thank you very much for inviting me here. I have played multiple roles around the world in my journey as an architect, where I taught and studied architecture at MIT and then taught architecture, came into the nonprofit sector where I founded Digital Partners Foundation in late 1999, early 2000, where we were trying to bridge the digital divide, ran Microsoft's corporate philanthropy for a decade, and now I teach at the University of Washington, consult with nonprofit and corporate organizations, and I've just written a book called Purpose Mindset, and now I'm focused on trying to get everybody in the world to craft a individual purpose statement for themselves. So thank you very much, and happy to be here.
We are happy to have you here. And Akhtar, not to pick on you, but I'm going to start by giving you the first question. You have a background with a major tech company. You've been involved in international development throughout your career. And I just would like to invite your perspective on the nexus between the two. And maybe even you could give us an example of a use of technology that has helped move the needle on some development goals.
I think that, look, technology is here to stay, right? It's become ubiquitous. It's becoming ubiquitous to people, even on the underserved community. I mean, you can travel to the furthest corners of the world, and there is somebody or the other with a mobile device, whether it is a feature phone or a smartphone with rudimentary access to the internet. So we know that technology is continuing to have deep penetration. And we've also seen over the last 20 years that acceleration in impact, right? So technology is here, and it's being used for multiple reasons, right? The simplest reason of education, where kids are able to learn through technology in a far more effective way than they would otherwise be able to learn in the classroom. We've also seen in the pandemic that we've actually become much more comfortable with even doing our healthcare based through technology. And it opened up different opportunities, even in rural communities or underserved communities, to access technology. To access healthcare to technology. Let's look at how technology has been used effectively in refugee camps around the world, where people are even using high-end technology with AI and machine learning, where iris scanning is becoming the norm in some of these refugee camps, so people don't have to carry cash with them all the time, and reduce, some of the friction that might actually come about with so much cash being in there. And then we're also seeing drones, deliver vaccines and other needed healthcare supplies into remote locations. So we are seeing technology play an important role. And for a very long time, we've been working with how do we get effective communication systems set up during a crisis, a humanitarian crisis. And people have been working for the last 20 years to try and figure that out through our landline and cell phone and internet connection. And now with Starlink, SpaceX is actually able to do that in a very quick way, right? And they've been able to provide it during, the volcano eruption in Tonga, or now what is happening in Ukraine, or other humanitarian crises. So we've got several examples of both high-end use of technology and also some rudimentary use of technology. And obviously what Amplio is doing with its talking book is very much filling that niche of centering people in a way that they are not just consuming information, but they're also contributing to knowledge. So let me stop there.
That's a great response. I really appreciate all the examples that you offered, and particularly because some of them are lower tech, some of them are much more sophisticated, and including the reliance on AI and retina reading. But Livia, I'm sort of interested, you've got a pretty strong background in financing development. And I'm sort of interested, particularly after Akhtar spoke about the acceleration of technology, the penetration of technology. What have you learned in your experience of financing these interventions? Are there things that you look for, things that you try to avoid? Can you talk a little bit about that?
Sure, Dena. I absolutely agree with Akhtar. Technology is here and it's here to stay. So then the question becomes, what is technology for, right? And to me, the first lesson is that you need to keep in mind that technology is not a tool. It's not an end, right? It's a means. Mm-hmm. And so in the projects I've been involved in, we've had to use from GISs to define project scope and areas and so on, all the way to using more appropriate technologies for the implementation of the project. To me, the question really, let's say, talking about technology that goes directly to the beneficiary, I think that the technology available is extremely important, right? And I'd like to give two examples of how we've used technology in projects. One is not directly in an area in which I used to work, but I was also very much involved, was the use of technology for access to markets by agriculture workers. And the question on what's the price of the seed, what's the price in the market, what the weather is going to be like, what are the potential for certain products, what should you be planting, right? That information has really changed the lives of many people, and going all the way from, improving what they produce, as well as, improving their access to markets. A very simple way of looking at technology is sending, for example, SMSs, right? Text messages. And we've used that, for example, for nutrition projects, where we've worked on sending text messages to mothers to remind them that they need to go to the health facility for their own checkups, for the child's health checkup, reminding them to feed certain foods to children that are richer than others, and so on. So to me, you know, you can really think about technology in very, very many ways. What you need to look for is understanding who your objective group is, what is the available technology that they will use and that they will be motivated to use, and then the content, okay, of the messages in these cases, right? And to me, then the technology can become extremely useful. And actually, you know, the World Bank is really into doing evaluations, and we've done impact evaluations and shown that the technology really has an impact as long as you've designed your project well within the context of the needs of your beneficiary group. Let me end with that. Thanks.
I love that. And it's such a great setup for Catherine, because you talked a little bit about, I mean, one of the points you made that I love was that we have to remember technology is a means, it is not the end. And one of the things that your group does, Catherine, as I understand it, is really try to make the connections between the content that Livia spoke about, the communication, and then the behavior change. And again, that kind of goes back to something Cliff talked about in his opening. And I wondered if you'd be willing, Catherine, to just talk with us a little bit about the linkages between the content, the communication, the behavior, and why that matters.
All right, thank you. Thank you very much for this question. Very interesting to hear perspectives from Livia as well as Akhtar, because they're very real and quite relevant in the current work that is happening around behavior change. I would also like to just begin by saying, even as I comment on the linkages between communications, content, as well as behavior and outcomes, just to acknowledge the progress and the work that Amplio has been doing over the years. Sorry, I think there's a bit of dog noise from my background. Okay. Yeah, so I'd like to acknowledge what Amplio has been doing. We've seen the progress and the incorporation of behavior change components, SBC, in the context of technology, which is quite impressive. And we look forward to continuous growth in this area, because we see that it's continuing to be as relevant and contextual as possible. So I'd like to talk about this connection and the linkages that you have mentioned. We as an organization are specialized in doing social and behavior change programming. And what we do at the center of our work is to ensure that really the process that we engage in is evidence-based. It's also interactive and quite planned in a number of ways. And when we do this, we ensure that we aim at changing the social conditions as well as individual behaviors. These are some of the aspects that Cliff alluded to in terms of social norms, social issues that are so critical when it comes to behavior change. So we provide information, we provide content and communications, but we acknowledge that it is not really enough to change behavior by itself. So we go beyond providing information, we go beyond providing content, we go beyond that to incorporate strategies that help us to influence social conditions, as well as in relationships that shift behavior. And so these shifts usually are measured as outcomes. So we look at various perspectives, content provision or communications, but we also influence social conditions and also influence relationships that shift behavior. So let me just go give an example. an example of a program that we have implemented that gives a good connection, a very simple example. We've done several programs in the development world, both in health, agriculture, and different components. But this specific example here that I'd like to talk about is actually nutrition program, which is on iron and folic acid supplementation for pregnant women. So we provided information around this aspect to the pregnant women, but we went ahead to the relationships that influence the pregnant woman by providing information to the partners and other influencers. And we also trained the healthcare providers. In addition to that, to be able to shift behaviors and other factors that influence behavior, we went ahead and did quite a bit of advocacy to improve access and supplies on the iron and folic acid supplements. So this is just to say that the connection between the information, behavior, and outcomes is so critical. We need to provide the information that is needed, but also work at shifting behaviors, because that is how we connect to the outcomes that are critical to programming. And I see that the progress that we are making and Amplio is making in combining and bringing in social and behavior change and technology helps us to be able to shift behaviors and also be able to gain quite a bit of outcomes through this, which is really looking at a combination of mutually reinforcing strategies that facilitate behavior change and also improves outcomes. So let me just stop there. We'll talk a bit more specifically on examples of the talking book and how we have seen outcomes in a different project that we have implemented. Thank you very much. Over
thank you, Catherine. And I do look forward to that. That would be great. You did a great job of explaining how your program works and what some of those interactive components are. And I think for me, the thing that was most interesting was to hear about the relationship between not just individual behavior change, but also the social conditions. I think that's a really important component that you brought through very clearly. Akhtar, I'm going to come back to you and I'm going to shift gears a little bit. You know, when I was at the CDC and then again at the Washington Global Health Alliance, one of the things that I heard regularly was that a mistake we make often in the development world is to develop a piece of cool technology and then look around for something we can use it to fix. And I'm wondering if you have ever seen that in the work that you've done, if you've seen any examples of that, if you'd be willing to talk about that, lessons learned.
Yeah, I mean, that's all the time, right? I mean, that's the way the world works, right? We come up, you know, somebody comes up with a cool idea and they think this is going to fix everything. And then lo and behold, it doesn't work. Right? It starts off at the highest level where people are trying to run a business. It starts off when social entrepreneurs who are sitting here are really not in the context of what, you know, they're not proximate enough to the situation. And they kind of dream up something that they think is cool and it doesn't work. And before I give an example, I want to kind of just also highlight why it is very, very important where, you know, you take the entrepreneurship mindset and it says, try, take a risk, fail forward, fail fast, move on. It is actually irresponsible to use that same approach when you're actually thinking about working with people in poor communities. Because in poor communities, you actually do not have the opportunity to fail and fail fast and move on. Because you might actually destroy their existing systems in your failure, and then you leave behind nothing. And talking about Ghana, we know that, you know, there was this whole, you know, merry-go-round that was built, which was to say, this is the way we're going to pump water in villages, store them in tanks, kids are going to play. They're going to help pump water. We will use these tanks as a way to create billboards and, you know, companies will provide us with funding. And we quickly found that, you know, they put all of that infrastructure in place. And then after a while, the kids got tired of playing. And in that process, you're actually destroyed the traditional way in which people were actually getting a most basic requirement for life, because that system got destroyed.
Mm-hmm.
So just saying that, we've got to get women to not carry water, because for us, it might actually seem in the Western world as demeaning. There, it was actually a fabric of their society. That was the way that women went to the village well, they interacted, they formed their community. That was the way they were getting out of the house. So it's, people need to understand first the holistic system of communities in which they're going to intervene, and then decide whether technology is going to amplify or help it or not. So technology should never be the driver. The driver should be humanity, driver should be human relations, driver should be human progress, and then look at whether technology can actually help that. Amplio does that. Right? So of course, Cliff has learned his own lessons along the way, as they have looked at how to modify and change the talking book so that it becomes much more contextual and much more relevant. So I think it is really understanding these intricacies to me that are important, than actually saying, I'm going to lead with technology.
Mm-hmm. That's really powerful, Akhtar. I really appreciate your response. And I think emphasizing the context and understanding the community that you're working with is one of the things that I heard very clearly. But also how damaging it can be to take our fail fast mentality into a community that has vulnerabilities built in. And Livia, I wanted to ask you about this as well. You have seen programs, interventions that have taken place in communities where maybe literacy is low, where perhaps the infrastructure is weak. And again, sticking with our theme of how technology, appropriate technology, can benefit development and health. I wonder if you could talk with us a little bit about how effective programs deal with those barriers.
Sure. Look, I think that a project to be effective, you need a couple of things, right? One is you need to understand the problem, have a good theory of change, and then have a good design, right? Now, I think health is always an extremely good example of where you can have effective programs, mainly because health has a lot of evidence, right? And so you can basically use that evidence to really have your causal chain and say, look, these are the problems and these are the potential solutions, right? But still, what, as you say, what can be result in, I'm based in Lima, Peru, right? What you can do in Lima, you cannot do in a very rural area, be it Peru or be it, some country in some other continent and in the rural areas. And to me, one of the things that, for example, surprised me, this is not exactly technology, but it's something that makes you aware that you really need to understand the cultural practices and norms, as Akhtar has said about women carrying water, was that we had a health project where we wanted to ensure that women had access to a health facility for the delivery of their babies, because that reduces enormously the risk, and it's massively proven by science. But the question is, women didn't want to come into the health facilities because the walls were painted white, and white in their culture meant death. So why would I want to go and give birth to my child in an environment of death, right? And when we changed the colors of the walls to more sort of terracotta type colors, which the doctors hated because they said it was dirty, right? The incidence of women coming into the health facility increased, right? So this is not really technology, but you can see that understanding what the issue is, understanding the local culture become extremely important. Now, let me say the communications part and what Catherine alluded to, the changing of behaviors is extremely important, especially if you're working on social programs or programs where you want to have an effect on people's livelihoods, right? And so how you deliver the messages becomes extremely important. And even though I've never had the opportunity of using the Amplio talking book, the one thing that has always been an issue with the programs that we've worked is that we've worked with indigenous peoples, right? I've worked mostly in Latin America, where we have indigenous peoples who live multiple, who work or live with multiple languages. And often, especially women, do not speak the official language of the country, be it Spanish or Portuguese, for example, in my region. And one of the things that happens is that it's very difficult to develop training programs and really have an impact massively in the local language, right? Because they don't read, as you were saying, many of these people do not read. And so the question is, how do you really have an impact with a larger training program? So to me, the issue of really understanding who your beneficiaries are and then adjusting the technology to them is extremely important. Thank you.
No, that's it. That's terrific. Thank you, Livia. I think one of the things I'm hearing come through all of your comments is that it's not whether technology is the answer or not. It's having an understanding of who you're working with, having the appropriate technology that serves the people. And Catherine, I want to come to you for the last question, and then I'm just going to put you all on notice that there is a lightning round after Catherine, and then hopefully we'll have a couple of minutes for to maybe take a question or two from our attendees. So having heard Livia talk a little bit about context, about really understanding the problem, about having an effective theory of change, about developing a program that's going to be effective. Catherine, you've been involved in many of these campaigns. I'm wondering if you have seen any interventions that actually surprised you, or that delivered better results than you had even hoped for. Would you be willing to share with us some of your experiences?
Okay, so thank you very much for that question. Indeed, we have implemented many programs, actually over 50. However, I would like to share just one experience that was quite interesting. We partnered with Amplio, and through the funding support of USAID, implemented a program in one of the counties in Kenya. This program was about issues to do with family planning, reproductive health, maternal health and nutrition. So it was implemented in 2 counties, and we followed the rigorous process of doing a formative assessment, human-centered design approaches at the beginning to be able to understand, have an in-depth understanding of the situation and the communities and the context, and then got to design a strategy. Of course, used multiple strategies, and then implementation and all that. One critical factor that stood out in this program is the fact that the communities that we were serving really had very low literacy level. And it has been really a big challenge getting to reach out to these communities in a way that gets to connect with their needs and gets to connect with what is very critical for them to be able to impact on the various indicators. And the other thing is I've been in the behavior change SBC programs, for over 20 years. And over that whole period, we've been implementing different communication initiatives. But one thing that has always come out clearly and, that has been a big gap is just the measurement of the messages and the content that you deliver. And so the talking book comes in with a big benefit of being able to measure the performance of the messages and the content and all that. So this was a big plus for this program and this technology, which is really unique from any other. So you can stand, and give quantitative figures in terms of this message reach and the measurement around that. So it was quite successful, and what we did is measure the performance of the program before and after, and had trend data put together and analyzed to compare the results in different communities for on behavior adoption and conversions as a result of use of this technology. So let me just give one case study of a facility in the community that we followed through after the introduction of the talking book. We trained, it was a small facility in a very remote rural area, and we trained about 15 community health volunteers in a community unit. They was expected to reach about 1,200 households, and with a population coverage of about 10,000. So after the introduction of the messaging and just the communications using the talking book in this area, we saw an steady increase in several indicators, and the particular indicators that we were tracking were the new antenatal care visits, as well as facility delivery with skilled birth attendants. And specifically, we actually saw an increase between, it increased. We saw an increase from 19% in first quarter to 94% in quarter 4 of the same year. Compared with the previous year, we saw quite a big increase in terms of new ANC visits, as well as, it actually increased from 34 new ANC clients to 85% to 85 new clients in quarter 4, which was an increase of over 200%. So what we want to say is this really surprised us, because this was a low literacy community, very hard to reach. However, we saw quite a big impact just after the introduction of this technology that spoke in their language. We could relate with the people that are there and all that. So the sessions were conducted, and the coverage increased, and those two indicators performed very well compared with the same year previous year, the same period the previous year. So that quite came out very strongly, and it was a very, very good indicator and initiative. And we saw if this is continuously scaled up and we continue to work on this technology and incorporating the other SBC components, then we're going to see quite big success in the coming years. So this is just one, and just to report that yes, quite a bit has been happening and was happening around that period when we were implementing this program, and it's worth replicating and scaling up. And enough support just needs to be given, because it is working in the hard to reach, low literacy communities, and communities that are quite marginalized and affected. Thank you.
Wow, Catherine, that's an amazing story. And thank you for speaking to how the talking book helped you overcome that challenge of really connecting to the community, but also being able to track the indicators and to see just how effective the program really was. It was a great story. Thank you for sharing that. Livia, I'm going to put you on notice that you get the last word. And I'm going to go right back to Catherine with our lightning round. Here's how it works. I'm going to ask a question. You get 30 seconds to respond. And so, Catherine, you are next up. And my question is, what would you say is the most important component of a tech-enabled intervention?
All right, mine is going to be simple, is adopting a human-centered design approach. Just helps us connect well with the communities, helps us to be relevant, contextual, and just serve the way we should. So that is it for me. Thank you.
That is a beautiful answer. Akhtar, what do you think is the most important component of a tech-enabled intervention?
Well, I mean, I was going to say human-centered design, but I also feel that increasingly we've got to respect the proximate leadership and people that are on the ground and work with them to really figure out what they need. And if technology is not the answer, then it's not the answer.
That's a great answer too. Thank you. Okay, Livia, last word.
Okay, so I absolutely agree with Catherine and Akhtar. And just to add, I think that what you need to do is monitor, evaluate, and correct. Because if you know, as we've heard several examples, you know, I mean, sometimes things work, sometimes they don't work. You need to evaluate how things are going and then make corrections with the technology to improve the impact.
Yeah, that's great. And actually, I think I heard each of you identify very similar things. I think the experience of these three people has helped us arrive at a much more clear understanding. We need to be able to monitor, evaluate, and correct. We need to have local leadership. We need to have human-centered design. And my experience with Amplio and the talking book is that it's really an almost ideal tool to use in many of these settings. So we've gone a little bit over our time. I can take a question or two if we have them, but I feel like I maybe need to turn this back over. Let's see if we see anything in here. Oh, here's a good question. If you had to recommend an area of improvement or development for the talking book, what would that be? Anybody want to take a gander at that before we close out the panel?
I can take that. We used the talking book, and at the beginning there was a bit of issue with the battery because of the cost, and that recommendation has so far been implemented, which is great. We now have a rechargeable battery, and that's cool. Thanks.
Awesome, that's great, thank you. Any other thoughts on that one?
I would just say that if one, and maybe, you know, Cliff and Amplio is already doing it, but there are innovative young folks in Africa that are actually coming up with interesting technology. And whether they have actually used Amplio and the talking book, and whether they can recommend new things that actually go beyond just voice, which could actually include certain gamification that can actually aid in learning and understanding.
That's a really interesting response. Thank you. That's very thoughtful. Livia, I don't know if you want to add anything, or if maybe I should, we are running desperately short on time. I think maybe we should probably turn it back over. Cliff, do I give this back to you?
Dena, can you pass it over to introduce Christine, please?
I can introduce Christine because Christine is one of my favorite people in the world. Christine Chu is our board chair. She's been my moral support and mentor since the minute I got here. And she's going to close us out.
Thank you, Dena, and thank you. Thank you so much to everyone who took time out of your day to join us. I am Christine Chu, and I have the distinct pleasure of serving as the current board chair for Amplio. I was actually inspired to join Amplio's board many years ago, in part by a presentation from Catherine. Talking books, as you heard from our presenters today, talking books are much more than a technology. They are a carefully designed technical component of Amplio's larger human-centered change strategy. They are integrated into specific projects in a number of ways, from distribution to homes, to facilitated group sessions, to persistent availability at locations like hospitals and schools. They allow users to share their feedback, including nuances about the social context that impact their participation, as Livia noted about the color of walls, and allow partners to adjust their approach to increase effectiveness. They are used to train and support community volunteers, creating local experts. Their content is developed with local partners in local languages in relevant ways. These talking books amplify and reinforce the information and behaviors and programs from health to gender equity, to agriculture, to financial independence, and more. Thank you so much, Dena, Livia, Akhtar, and Catherine. I hope you enjoyed hearing from them as much as I did. Their partnerships with Amplio have helped us amplify the many messages of partners around the globe, working to empower individuals and communities in ways that truly take advantage of Amplio's unique technology. As you now know, Amplio has reached nearly 2 million people in 14 countries, and with continued partnerships with amazing organizations around the globe and the support of our generous donors, we are working to empower even more of the world's most vulnerable communities through knowledge sharing. After this session, we will send you a follow-up email to see how we can create even better future presentations. Also, if you were inspired, as I know I was, I encourage everyone to consider making a contribution to help us increase our impact collectively around the world. Thank you so much again for being here today, all of you. I wish you all a bright and celebratory season ahead. Thank you so much.